Hi, and welcome to Birthright, a podcast about joy and healing in Black birth. My name is Kimberly Seals Allers, and I'm the Executive Director of Narrative Nation. I'm the founder of the Earth app, and I'm honored to be here to really center conversations about Black birth, Black joy, and inspiring hope. We are live today at Congressional Black Caucus at the annual legislative conference. And we are here in the midst of all the talk of policies, politics, in the shadow of the White House, and talking about a very important topic, which is Black maternal health. I'm so honored to have with me two of my friends, my comrades, my colleagues in this conversation and in this mission and movement to eradicate racial disparities in maternal infant health with me. And so we're going to get into a conversation. So, first, to my right, I'm so honored to introduce Coach Jessie Thompson. Jessie is the founder of the Detox Now. She is personally created, I can't read my thing, personally battled the epidemic of fibroids for 14 years and the resulting infertility for 10 years. She bravely shared her story. She is currently featured in the OWN TV's Eggs Over Easy. And also, Essence published a profile called My Fertility Journey in the 2014 Mother's Day issue. Jessie, thank you for joining us.
Thank you for having me.
And then also with me, I have Dr. Twyla DeLeon. And Twyla is a dedicated leader in maternal and infant health and nonprofit management with expertise in philanthropy, Medicaid reform, data analysis, and academia. She serves as a president and CEO of Health Connect One. Twyla, thank you for joining us. So we are here in the at the Congressional Black Caucus ALC in the midst of a lot of activity and noise, but we're talking about Black mamas. Like, what's the context? Why should everybody care about this issue? And particularly the audience that's here today.
Well, I want to say, first of all, I'm so excited that we're centering this conversation the way we are because Black maternal health is a human rights issue. Okay. There are only two kind of people in this world, as to quote my brother Charles Johnson, who is our fellow activist and change agent in this movement. You know, there are only two kinds of people in this world: people who are mothers and people who have mothers, right? So this is an issue that affects us all. And then when you fix maternal health for Black women, you fix it for everyone. So we are actually doing something that's going to improve maternal health for the whole world. When you fix maternal health, you are ensuring that we have healthy, thriving people.
Yeah. I mean, Black maternal health is at the cornerstone of our communities. And it does involve politics. It does involve policy. It does, make us talk about racism and bias and all the things that are so important. Twyla, what were you thinking?
So we know the U.S. has the worst birth outcomes of any high-income nation. For Black people, that's even worse, right? Black Americans have built this country, and they're vital contributors. We absolutely need to ensure that they have access to quality, bias-free healthcare so that we can make sure that our communities and economy are whole.
Yeah. And I think, many people feel like this is, to your point, a conversation about Black mothers, but it's a conversation about all of us because we're all affected, one, by motherhood, and we're all affected by Black women in our communities, right? And so if we start to divvy ourselves up, that's not the movement that our community deserves, and that's not the way of thinking that our community deserves. Jesse, you take a real holistic approach to thinking about these issues, and your approach with the Detox Now and your own personal story. As you see it, what exactly is going well for Black women in the system, but where are the opportunities for improvement?
So what I love about, I guess, the current age that we're living in is that we have agency, right? So what holistically we're able to share knowledge and information where women know now, okay, what's in my power to do, right? That's what we focus at the Detox Now. We focus equipping women with what is in your power to ensure that you have the best care, right? That you have the best health outcomes as far as in your control. But then also equipping them with knowledge as to how to advocate for themselves, right? As to how to know what good care looks like and also to because this is funny because not everybody realizes that they deserve abundant health and that it is their birthright to have safe and caring birth services. Like, unfortunately, it's become this thing where we're just afraid. We were very much in a place of just a fear place, and it's like, wait a minute, you know what, we deserve better, so now we're going to command better, and we have the agency and the tools to do it.
Yeah. And I think that's important. I mean, for me, a big part of that is the storytelling that needs to shift, right? And I
Absolutely.
started Birthright because I was deeply concerned about the negative focus, and every media story was about a new dire statistic or another sensationalized death, another one of our sisters dying. And we really needed to actually show what was possible and
That's
to
right.
actually create a different conversation, and I think that's part of what's been robbing people of the experience is the stories that are being told about us, more inspiring stories like yours,
Right.
more stories that show like actually there can be something on the other side, and even though there may be lots of challenges and
There's still
trials.
opportunities. Like,
That's right.
the fact is, even if you are educated, even if you know everything, the racism is still so embedded in the fabric of the system that you have to have the advocacy that is relentless. That's why doulas are so important. And that's why partners, in fact, having I moderated a panel this week at CBC on it was empowering Black fathers to become allies in Black maternal health, and that was so important because they are really the very first doula, right? They're in this together. It has to be a team effort so that we understand that they're empowered to know that everything, all the options, all the things to be looking for, so that we have that support system together.
Right.
And that's a critical part of changing the narrative and changing the outcomes.
And changing the experience, right? Like it was never meant to be birth in isolation. It was
Nope.
always meant to be communal. It was always meant to be about community and having people with you, your mother, your aunties, your
Yep.
grandmothers with you. And I think even for us at Earth, we're trying to bring that community back on the digital platform. The ways that we as a community can come together and inform and protect each other. The ways that we, that community, can come together.
It's a village.
That's right. And hold these hospitals accountable and start demanding better providers and saying that we're actually bringing transparency to the space, as a community. And then that's when we all win, when we're kind of moving together.
Absolutely.
Yeah, so true.
And history has shown that.
Yep.
And everywhere where we've won, it's been because together we took a stand together.
Absolutely, absolutely. And as Jesse was saying, part of that community is doulas, right? And making sure that we have doulas who look like us, understand us, but also that they're being respected on the hospital side. Twyla, you've done so much work around doulas and making sure that they're paid and making sure that they're respected. First of all, let's just talk about what a doula is, because we are at AOC. We don't make any assumptions. So first, what is a doula?
A doula is a non-clinical support for birthing families. So someone who isn't going to do any of the delivering, but can help with education, comfort measures, and referrals to resources that are really necessary in a lot of underserved and marginalized communities.
Yeah, I always tell people doulas are like, belly up.
Yes.
Right. They're not belly down. So they don't catch
Exactly.
babies, and they're not doing anything down in the birthing areas, but they provide great support to mothers throughout the process, prenatally, during birth, and postpartum.
And huge advocates,
And
right?
they're huge
so being
advocates.
able to support and raise the red flag if there are challenges, educate folks into when you should go and get better help.
Another thing that I really like to warn our community about, because a lot of times, and you probably have seen this on social media, people like at a birth looking for a doula, going live. And I'm like, the value of doulas is really the education they do prenatally.
Right.
Because
Yes.
I know for me, I had 2 C-sections that I still can't explain, and I didn't know what questions to ask. Right. And a doula wasn't about her being there necessarily, but I would have been prepared to know what to say when I'm feeling coerced, the questions to ask, what can I respond to? That's the piece that we really want our community to remember, that the work of doula and even checking a provider is appointment 1 work.
Yes.
It's
Yeah.
not at the birth work, right?
No.
By then it's often too late.
Exactly.
And so when you're thinking about providers, what are the questions that you need to ask early on? I'm like telling people, pick your doctor like
It's
your
like
hairdresser. The minute
the
you
best
mess
cheat
up,
sheet.
that's the
That's
time to go.
What you just said made me think about it. It's like having the ace player, right?
Right.
Who has had all the plays, who's seen all the moves, And now it's telling you, look, cheat sheet. No. This is a red flag. I know what's going on here. This is a warning sign to, right? Because when you're in that place, typically speaking, a first birth, here you are, you don't even know, how did I end up getting a C-section? Right? Like, wait a minute, there were signs, there were things that were happening along the way, and someone needed to be there advocating for you.
Yep, exactly. Which is why I'm always like a big advocate for doulas, and I really wish I had one. It's too late for me now, but I'm here for everybody else to still be in that journey. Twyla, tell us a little bit about, where we are with doula policies right now. What's going well, but what's getting in the way of joy for even our birth workers?
Yes. So many states have put doula reimbursement into place, and there are many states that are gradually getting there. I think something that has been a really big win is having the doulas that are doing the work on the ground, especially Black, Brown, and Indigenous doulas, at the table at the beginning, as even before the policies are created.
Right, at ideation.
At ideation, yes. And then throughout iteration after the fact. Just because the policy is written doesn't mean that it can't be revised. There are a lot of things that we're recognizing that maybe we weren't sure about at the beginning, right? One of those big things is the reimbursement rate. And that's a big sticking point for a lot of folks who are in this work. Doulas are on call 24/7. Doulas who are in communities where there are more challenges are constantly, being able to answer questions, help get people connected to different resources that a lot of other folks may not necessarily have or need access to.
Right.
So it's a very high stress
and the
job.
doctor's going to show up at the birth for like maybe 30, 45 minutes. Those doulas are there for hours. I'm just talking to doula Lester. She had like a 60-hour labor.
Yes. And it's hard on the body, right? So the amount of effort that they have to put into helping people to get comfortable, walking with them, talking with them, and then the emotional burden of it, it's really heavy. So one thing that isn't necessarily reflected in policy is the fact that this work is very hard work. The reimbursement rates likely are not appropriate, and even getting enrolled as a Medicaid provider can be a massive barrier because the process is the same as it would be for a clinical provider. These doulas, many of them work independently, they're business owners, and they don't have the legalese expertise to go through that process. Another huge barrier is when states set a list of doula training organizations. In many cases, these training organizations are white-led and do not speak to a lot of the things that the communities need. We need to be focused on core competencies and being culturally relevant, because doulas don't even want to go to some of those trainings because they're feeling the bias out of the gate. So it's very important to pay close attention and be comfortable being able to change. Certain states have done a really good job. California, New York, Illinois, New Jersey, there's been some challenges, but New Jersey really being kind of ahead of it, recognizing that they need to bring people in order to keep the conversation going and not stop at whatever the policy said initially.
Yeah. And I feel like what we're hearing across the board is like systems challenges, cultural challenges, all the things. Let's talk solutions, because I know we are all solution-oriented people. And we're here, in DC with policymakers and politicians and folks who care about what's going on in our country. So what are some of the solutions and call to action that we can put out there for the folks that may be listening, for this particular audience, and for people who may not have thought that maternal health, and specifically Black maternal health, was an issue that was important to them?
For me, I go back to my what I call my 3 laws for exceptional patient care. All right. It is listen to your your body, your advocates, and your experts. And the way that breaks down is your body. Pain is a vital sign. Always, it needs to be. Pain is a vital sign that requires urgent response, right? There are too many women. In fact, it's one of the top responses on the Earth database that their pain was dismissed, right? Yep. So it needs to be treated with urgency. So if you're in a situation where you're dealing with pain, and it's not being dealt with urgently, then we need to go to someone else. You can't just go home and say, well, they sent me home. Until you have a real response and understanding as to what is driving that, don't stop. That's number 1. So that's your body. A is your advocates, all right? Listen, medical bias is real. That's why we're having this conversation. So what I say is that everyone deserves and needs an advocate. So in the birthing world, that's a doula, right? In the regular medical system, they need a patient advocate. This is not a maybe, an option, a suggestion. No, everyone, you shouldn't be seeing a doctor without an advocate present. That is where I stand now, okay? Because there's so many things you miss, and there's so many things that you don't understand that you're going to get lost and possibly neglected, misdiagnosed. I've seen it happen over and over. And the last one is that there are always experts, two experts in the room, right? That is, you are the expert on yourself. Yes, the physician is the expert in their field, but you are the expert on yourself, and never stay with someone who's going to dismiss your expertise. Again, when we go back to the Earth app, because the Earth app is one of the greatest solutions ever. It is a tangible, structural, functional solution to helping end birth inequities, right? And what I love is, again, it goes right with that. What was another one of the top responses was that they were treated with disrespectfully. Right? They were treated disrespectfully. So if I don't respect your expertise, I'm treating right. Wait a minute. I'm not treating you with the proper expertise. I'm not treating you with the right respect. So that for me, if providers would do the same, listen to their patients, body advocates and experts, and if patients would listen to their own body advocates and expertise, it could literally transform everything. And that would require that they now make decisions based on that.
Yeah. And I think that one of the things, thank you so much for lifting that up. I'm just going to put out there on a boilerplate for those who may not know, Earth, which is like the word birth, but we dropped the B for bias, is the first of its kind nonprofit Yelp-like app designed just for Black and brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians. So we are all about us using technology to crowdsource where we're getting good care and where we are not. On the back end, we turn these reviews into data to literally work with hospitals to create quality improvement plans rooted in Black women's voices, and then hold them accountable for how they're treating us, holding them publicly accountable. I remind everybody that ratings and reviews are changing how we do everything. And nobody here is going to a two-star hotel on purpose, right?
Reviews are used for
everything. And we can use this tool in service of the Black women who are being disproportionately harmed by our current system. So I'm really honored that I've been able to build this platform and have it out there. We need your help. We need your support. Everyone download it, leave reviews. We also accept reviews from fathers, doulas, and also hospital-based midwives. And I think the point was really about how do we bring innovation into this, right?
Yeah.
Like, Earth is a technology platform. There's a lot of telling Black birthing people what more they can do. And we need also to think about how systems can be held accountable. What are the policies to the policymakers? What are the laws that can be out there to actually hold hospitals accountable? What are the ways that payers can step in to make sure that tools like Earth or others even like it are being included in how providers get paid? How do we make sure that Medicaid and folks who are getting money from the government, should you be getting a lot of government money if in our platform, the hospital is consistently getting bad reviews from Black and brown birthing people?
No.
I think not.
No.
I think not, right? And so how do we create not just the policy, but the transparency and the accountability so that these policies actually work for the people they're supposed to be working for, And so I think that's the kind of the next level of we've been having this conversation. We've been talking about it.
Yes.
We're saying the things out loud.
Well, the Momnibus is on, right?
The Momnibus is there,
is a
right?
huge collection package of
12 bills,
mm-hmm. right, that will address so many of the issues in terms of for Black maternal health to end this injustice. And one of the things we talked about, Representative Lauren Underwood, who is head of the Black Maternal Health Caucus, right,
mm-hmm.
Talked this week about the call to action. Number one is that we need Republican sponsors for this Momnibus. And that means write letters. In fact, go to 4kira4moms.com, the number 4, Kira, K-I-R-A, the number 4moms.com. They have a tool on their website where it will populate, create a letter, just putting in your name and your zip code to your representatives, specifically asking to support this legislation. We need it. We need it. We need it. We need it. We need to make our voices heard so that we can demand this legislation.
Absolutely. And once we have it, we got to make sure it's implemented properly.
That's the next step. We got to get it. Then
that's right. We got to make sure it's implemented properly.
Yes.
Twyla, what are your thoughts?
In terms of what we need to do next,
call to
action. It's always money, right? So hitting them in the pocket if things aren't going well. I think when we talk about doula reimbursement and doulas being a requirement, folks having access to it, if those doulas are having challenges within hospitals, that's a whole other problem. These doulas are from the same communities as the people they serve in the best case scenario. When they show up, they face the same bias that the people they're serving face, just like a dad would, right?
Mm-hmm.
So it's a huge challenge. It's important that those hospitals are required to go through training, right? Are required to make policies that make doulas actually want to come and partner with them to give them better outcomes at the end of the day. So they definitely need to be, I don't want to use penalized as the word, but there's
Penalized.
element to this,
Incentivized.
right?
I believe in
Incentivized.
carrots and sticks.
Carrots
Yes,
and sticks.
yes.
Carrots and sticks.
Yes.
Yeah. So they need to be required to go through the same kind of training. Core competencies, as I said before, we have a whole group of community-based doulas that we're bringing together to form a coalition because their voices aren't at the table. These are Black, Brown, and Indigenous doulas from across the country. They don't have a seat at the table when all of the other associations are present, including the representation for the hospitals and the health insurance plans. So we're working really hard on that.
Mm-hmm.
And one of the things they're pushing for is core competencies. There are many models for doulas to be trained. And we need to make sure that they're trained appropriately to support families. A lot of people will say they're a doula, but have they been trained appropriately? Are moms safe? And again, back to the reimbursement rates. Make sure those reimbursement rates are adequately updated. And New York State is a good example of this. New York State is ostensibly 2 states, right? The rate that someone's reimbursed downstate should look differently than upstate, and it can. But a lot of times we're afraid to really, change things. And I think we need to be more intentional and thoughtful about that.
And more intentional thought about that, because we can't talk about the value of doulas and then send them into oppressive work environments, because that's not going to contribute to sustainability. Right now, they're saying
And
the burnout rate,
a diverse and thriving workforce.
it won't. It's not a perinatal workforce issue, a sustainability issue. I mean, this is why even with Earth, we have our doula reviews because they help our community know that a doula said this. We have a special icon in the app so our users can know a doula left that review. But on the back end, we use those doula reviews to also help hospitals be more welcoming. They need to be doula friendly, doula hospitable, whatever word we're using. Because
doula ready, that's what we do.
Doula ready,
Yep.
there you go.
Yeah.
We can't keep sending them into work environments that are oppressive. It's not going to work. It's not going to work. And so, I think that is also critically important. And then getting doulas paid. What is the best rate right now in our country? Who's doing it right?
They're changing very quickly.
Okay.
So California, I think, just increased their rate.
To?
They were over 3,000. So I think
Okay.
we're getting closer to 4,000.
Per birth?
Don't quote me because I could be
Per
wrong.
birth?
Per birth.
But that
the challenge
includes, go ahead.
that includes the prenatal postpartum. The challenge with some of this is that when you're doing things in a Medicaid reimbursement model and not a model where folks are able to have something to start with, a lot of these doulas, this is their only income, or they work 2 jobs and they shouldn't have to.
Mm-hmm.
They don't have anything to start with, right? So you're getting paid per appointment or whatever else, and then after the birth you have to submit for reimbursement. You have to wait.
To
That's
wait
9
that
months.
period.
That is not sustainable for a lot of these
Not
folks.
sustainable.
The burnout rate is 3 to 5 years.
Then how many births do they have to do in advance in order to make sure they have cash flow?
And how many births can one person honestly support in the course of a year? It is very hard on the body. It's hard on the family because you need to get up, leave. Folks who come to this work, many times they have their own families.
Yeah.
Right. So it is really challenging. We really need to think about are there alternative payment models that still flow through Medicaid?
Yeah.
Mhm.
Right. Things that are more grant based that go to some of the
grant-based.
organizations
The
or
funding is upfront.
upfront
Yeah.
funding because it's not easy to sustain people in this way.
Kimberly, I was going to say the work that Earth is doing specifically around Earth approved hospitals, that's really important. You should talk about that because that is a major part of making, creating a birthing friendly world.
Right. Yep. And that really is our goal. I mean, and that definition needs to be community defined, right? Like not what makes a good experience to the people running the hospital, but what exactly is a 5-star experience as defined by Black people and more specifically Black people in your neighborhood? Because racism in New York City is not like racism in Birmingham, Alabama, which is not like racism in Sacramento, California, right? In places we're all working. And so, really making sure this is locally centered, that it's community driven. And that's really important. So now we're really honored to be working with 8 hospitals across 6 states, but we know that more folks need us. We know that our community needs to tell us who was our next target. I tell everybody, every Earth review is read. 90% of them I see, right? Except, my therapist is telling me to stop reading them all. That's okay. That's okay. I'm getting my self-care tools.
Yes,
but we are looking for our community to direct us and to tell us this hospital is giving bad service to Black and brown birthing people. We promise you, we will engage them.
Yeah.
We will try to bring them in to a improvement process. And if we need to go public with a public media strategy, that is something that we do as well. And so we just need our community to support and know that we're here to fight for them, that we're here to hold folks accountable, and that we can actually protect each other. So it's very exciting. It's very exciting, and it's a powerful tool. We want to put power back into the hands of our communities, and technology allows us to do that. So we're excited. So my call to action is for everyone to please download, please to make sure that you share the Earth app with someone, I always say to my team, if guy like a birthing review, it can take a few minutes. Birth is a structured review process because we're really trying to generate data. The birthing review may take you about 10 minutes, but I'm telling my team, if Geico can't convince us that we can spend 15 minutes to save 15%, we can spend 10 minutes to save Black birth, okay?
That's right.
We
Yes.
can spend 10 minutes to save Black birth. So please give us your 10 minutes if you've given birth and share your review. Every review matters. So,
And if you've had a child up to a year after with pediatrician
and you can leave
reviews.
pediatric reviews. So it covers prenatal reviews through your whole prenatal experience. Come back, tell us about your birth. We have a special review for parents, for mamas, for their postpartum visit, and then pediatric reviews up to the baby's first birthday, because what's happening to Black mom is also happening to our infants, right?
Absolutely.
So this has been such an amazing conversation. We are here talking about Black maternal health, center stage at Congressional Black Caucus, ALC. But I close every episode of Birthright by asking a question. And that question is all about us defining for ourselves and, what is our birthright? So I'm going to ask you all to close this out with a typical birthright signature and ask, Jesse, what is our birthright?
Vibrant, abundant, and caring healthcare. That's a birthright, right? Vibrant birth. That's healthy birth. That's a birthright.
That is our birthright. Twyla, what is our birthright?
Joyful and thriving families.
Yes. And I will close us and say, as my sisters have said, joy is our birthright. Thank you so much for joining me for this special live episode of Birthright. Thank you, Coach Jesse. Thank you, Twyla. Please be sure to follow Coach Jesse on Instagram, Health Connect One on Instagram. Make sure you're following the Earth app and me personally at I am Casey Ozalers. Thank you for joining us.